Welcome, everybody, and thank you for joining today's on-demand webinar titled Managing and Challenging Payer Policies. This is a webinar for healthcare providers navigating the complex landscape of payer policies, denials, and negotiations. My name is Josh Fearling, and I'm an SVP at Parathon, and I'll be your host for this webinar. But I want to say a special thank you to everybody that helped me gather the information, best practices for this webinar. So I want to say thank you to our clients, our executives and analysts that helped me put together these best practices and this information. So thanks again to them. While this presentation is going to be a monologue today, in the future we are looking at much more interactive webinars, panels that cover this payer policies and other hot topics as well in the revenue cycle. So stay tuned for those. So let's dive into one of the most pressing challenges in healthcare today, payer policies. Okay, so in terms of our agenda, we'll start out with a brief introduction and what we know. Then we'll jump into the payer policy landscape. We'll talk through the operational strategies and best practices that we have seen that have been successful. We'll talk about negotiation tactics to offset or challenge some of these payer policies. And finally, we'll get into some tools which can help you as you gather all the information related to the policies, the financial ramifications, the operational impact, the clinical impact, etc. So what do we currently know? So it's interesting if you start to look at payer dispute numbers. So payer disputes have increased from roughly 20% in 2022 to close to 56% in 2023. So payer disputes have gone up. That's no surprise. Coverage disputes have expanded from 24 states in 2022 to 34 states. And lastly, which is not a surprise if you're following industry news or health insurance news, Medicare Advantage. So of the 86 disputes reported in 2023, 59% were Medicare Advantage plans. So this is problematic. There's the payer disputes is, I'm sure if you pull the data, or once the data becomes available in 2025, it's going to be higher. So this is something to be aware of, and it's something that is serious. So let's talk a little bit about the payer policy landscape. And while there may be clinical rationale that is part of these policies, that's not always the case. And certainly cost control tactics are what is happening here in many of the cases. So we're seeing, and they may be grounded in clinical logic, they may not be, but they're designed to reduce the payer's expenses. And often this is at the cost of operational efficiency, profitability, and patient access at the hospital. So these policies are often implemented with limited transparency, and they can change quickly. And there's more of them that are happening. I think a typical plan could have anywhere from 10 to 20 policies, maybe more, maybe less, per payer. So what are some of the common barriers? So we're seeing barriers such as excessive denials, the bundling of procedures in ways that interestingly reduce reimbursements, like bundling in room and board charges and things along those lines. That's a huge problem. And unclear or hidden coverage exclusions. Altogether, these practices can delay care, confuse patients, and drain resources, become a huge financial and administrative burden. Bundling and coverage limits, I think, are something that I just wanted to focus on. So procedures once billed separately, we talked about this a little bit, but are now bundled together in a single payment, which can reduce the actual reimbursement. So we'll get into on the operational best practices related to this, but this is very interesting and it's happening more and more. Additionally, some drugs and services are being excluded altogether from coverage, and this shifts cost burden to the hospitals and the patients. Prior authorization, no surprise here, but more services now require prior authorization, often within narrow timeframes and with varying documentation requirements. So this adds administrative burdens and creates potential delays in care, and can often result in 100% denial with no opportunity to recover anything from that. So just huge administrative burdens, huge financial burdens. I mean, the policies are affecting the entire operational spectrum of hospitals. And that's why these best practices and that's why tools are of monumental importance in relation to this. So let's talk about some of the operational best practices. So to manage the complexity of these policies effectively, organizations need to move from being reactive to proactive. If there's one mantra here, it's be proactive. Very, very important. So first and foremost, real-time monitoring is essential. Policies change rapidly, and you must be able to track those across all payers and not be caught off guard. You need to also clearly understand the impact of those policies, the effects on patient care and revenue. Very important. This will go into some of the tools that we talk about, but this is very, very important because what's necessary when you have this real-time monitoring and impact assessment is a really key best practice which needs to be retained, which is real-time communications and cross-department communications. Immediately ensuring that all the different departments are alerted to this. Communications about authorization, coverage requirements, or different payer policy nuances are critical to update all these different departments. Because even a short delay can lead to a missed authorization window, which leads to lost revenue. So every policy shift has a consequence, and it's important that you're proactive in terms of that communication across the revenue cycle. And that includes case management, the managed care team who usually receive the policies. They're communicating with case management, revenue cycle, clinical, compliance, etc. Siloed operations increase the risk of oversight and delays, which it creates this trickle-down effect. So one of the best practices we have seen that I want to stress is the monthly standing meetings between all these operational departments, so you can proactively resolve these issues. Also, best practices in terms of communication of this information, whether that's done through, your EMR or it's done through some platform like what Parathon has in terms of contract modeling or our Gen AI, but you should be able to communicate these clearly and succinctly to all these departments in a relevant manner that's relevant to them. Clinical operations plays a role here. I want to just touch on this, that strong partnership extends to the clinical teams to identify policy-sensitive procedures early in the patient's journey. Very, very important. Help prevent any surprises post-discharge, such as retroactive denials or unexpected bundling. Of course, revenue cycle in this communication, these communications is necessary. They may need to flag something in your electronic medical record. They want to, avoid denials. Anything that affects AR is going to be very important to them. So these policies now are obviously affecting all of those things in the revenue cycle. So whether it's billing or reimbursements, revenue cycle must be immediately alerted. So proactive technology is very, very important. And that could be, we'll get into a section on that, but that's contract modeling, tools that can take every one of these policies, compare them to your claims, to your denials, and give you, an excellent impact assessment and allow you to communicate to these different departments in a succinct manner. Okay, so let's now talk about negotiation strategies, which is not just about pushback, but it can be about pushback, but it's also about being prepared and strategic. So first and foremost, what we've seen be successful, because it's important to note that you can change payer behavior. Yes, you can change payer behavior, but you have to have a data-driven approach. You have to use analytics to quantify the operational and financial impact of payer policies. This gives the leverage and credibility that is necessary for these negotiations. So you have to have the data at your hand, and we'll talk about some of the tools that can facilitate that. But important that you engage with the payers, engage with your provider reps early and regularly, building a relationship with the provider reps. We actually work with the provider reps when we're doing recovery related to clinical denials. We'll actually work with the provider reps. And we found this to be very, very helpful, especially in regards to appeals. So that's first, but do that by gathering the data, by taking a data-driven approach, and don't be afraid to push the provider reps. So leverage, managed care negotiations is a huge thing too, and that's where you want to have a win-win solution. That's where contract modeling is very important. So hospitals have an opportunity to address policy changes in negotiations. They can raise concerns as how these policies affect reimbursements, coverage denial, prior authorization requests, certain aspects of technical denials. So if you can quantify the impact of these policies, you can use these in negotiation. If you have a contract modeling solution, the third bullet point is you can create a win-win scenario here that maybe you're giving them something in exchange, because health plans are more likely to adjust policies when there's something in it for them. So that's where contract modeling and best practices become so important. Lastly, what we've seen be extremely effective is leveraging state and low federal resources. This could be the state's insurance department, different federal resources. But as long as you gather the documentation, you have the medical records, the treatment provided, the policies, the entire impact, these organizations can be used to help with some of these policies, or at least the byproduct, the trickle-down effect of some of these policies. So there's many states have, payer fairness laws, prompt payment status. Your insurance agency is critical. We've seen this work. We've worked with the insurance agency and seen that it helped improve our relationship with the provider reps. So all very, very important things to do. And having tools to be able to provide that data is very, very important. Finally, I want to talk about some of the tools that help with payer policies. So to support all the best practices and strategies, it all starts with the data, and to be able to communicate that data across all the different departments in a way that's meaningful to them. So these solutions make it easier. Contract modeling can load all the policy and contract mismatches and alert you to all the contract mismatches, provide you with the expected reimbursements, the impact and denials, and all those things. So the policy can immediately be loaded in the contract modeling system, and it could certainly help with that. And it can provide that real time, what's the impact of this. Generative AI, approaches to appeal generation by analyzing, using Gen AI to analyze historical outcomes, denial codes, contract language. The system can then generate appeal language and flag for potential regulatory protections. It's not going to help you, exclusively. You still will need the human aspect, the high-tech aspect of that, but it will certainly help in terms of different strategies that are working, not working, while they're working. Gen AI is a very important part of the appeal process, and as such, part of the policy process. Parathon has another product called Policy Edge, which automates looks at the historical outcomes, the denial codes, the contract language, helps to track the policy changes in real time and forecast how these changes could be impact reimbursement or denial risks, et cetera. And then performance analytics. So being able to look at all these parameters and historical data to assess how the payer policies have impacted your financials. Because this is something that I think a lot of hospitals could do much better, is to look at what's the impact on the financials of these payer policies. So in closing, by combining these operational best practices with technology-driven tools that allow you to have this data so you can understand the impact from an operation, financial, patient perspective, you can stop reacting to payer policies and start shaping the outcomes. You can influence, you can change the payer's behavior in terms of payer policies, and that can be quantified. So monitor the changes closely, assess in terms of next step, assess your policy management approach, identify the different technology or communication gaps, and then be able to address these payer policies. So thank you for your time today. I appreciate it. And if you have any questions, please reach out to me.